So this is chapter 2. It is titled, Would Someone Please Fix My Ankle? This is an interesting process because I'm kind of reading this along with you. I wrote a long time ago, and so time to see like what emotions get stirred up this time. So chapter 1 ended with the ER physician wrapped my foot up and gave me something that would change my life forever. Crutches. Little did I know I would end up on them for the next 9 months straight. The next day, September 22nd, 2005, I saw an orthopedic who said I would be back on the soccer fields in 6 weeks. I then had an MRI done, which showed there were no tears, just a lot of swelling. I was placed in a walking boot, began physical therapy the next week, and used crutches as needed. For the next 2 months, I went to physical therapy 3 times a week and was stuck using crutches because I could not put any weight through my heel for the life of me. I kept having terrible pain. The rubber on the front sole of my boot was starting to wear off from walking on my toes. At the next follow-up appointment with my doctor, he told me he didn't know what was wrong with my ankle. Yes, you heard right. He didn't know what was wrong. Then, with a voice like a magician ready to pull a rabbit out of his hat, he says to me, "I wish I had a magic wand to wave to fix you." Good grief. I didn't need drama. I needed someone to fix my ankle. His solution, you ask, was to dismiss me from his care without any suggestions of what to do next. I saw my physical therapist again, and I kept telling him, every single time I leave here, my ankle swells. I was kind of brushed off at first. He didn't entirely believe me. Lucky for me, the one day of physical therapy, I took my time getting my gym shoe back on, my left foot, and getting my ankle boot on my right foot. And surprise, surprise, my ankle started swelling. He was with the patient across the room from me. And I ended up asking him to come back so he could see that I wasn't lying, that it was in fact swelling every time their sessions would end. During this time, I was attending school. I was a junior. I was watching soccer from the sidelines. But honestly, it was hard to watch, and I didn't find the same joy that I once had. I was so lost because the sport I loved and played several times a week was taken away from me. I also lost my social support since most of my friends were involved in athletics, and I could no longer play. It was a very hard time. I felt like I had no control over what was happening to me. My mom had finished treatments for breast cancer the year prior and told me, sometimes we can't control what happens to our bodies, so take control of the things you can. From that day forward, I made that my mantra. I threw myself into my academics, learned to cook, and took charge of my own health and began researching ankle injuries. In the meantime, what am I supposed to do now? I've been dismissed from my doctor without being given any sense of direction. I was baffled. My parents were baffled. My parents called that doctor's office every single day for the next week until they ended up calling the physical therapist I was seeing to see if he would please talk to my doctor. A few days later, we got a referral to go see a specialist. When my parents called to make an appointment with the specialist, they were told he didn't have any appointments for the next 3 months. Waiting that amount of time wasn't an option. We were told his associate had an opening in about a week at the end of November, so we took it. On the initial appointment, I was given a script to go get an ultrasound done of my ankle. The ultrasound showed that 2 of my ligaments were torn on the outer portion. When I returned back to the doctor, he put me in a cast for 4 weeks. At the end of December, when I saw the doctor again, he took the cast off. I was still having a ton of pain on the outer part of my ankle. And even while in the cast, there was something that would pop on the outer portion. Since there was so much pain when the doctor tried to examine, he wanted me to go see a neurologist. I was so mad. It was an ankle injury. I knew it wasn't a nerve issue. Regardless of what I thought, I had to see the neurologist in order to move forward. It was another hoop I had to jump through. It was just another hurdle to put in my path. When I saw the neurologist in the beginning of January, he thought I might have RSD, reflex sympathetic disorder. RSD is a type of nerve disorder. Since I had some of the symptoms that correlated with RSD, such as swelling and stiffness in the affected joint, a burning pain, and inability to move the affected joint, the doctor suggested this was the diagnosis. This diagnosis, it landed me back in a cast for another 3 weeks. At this point, I had been on crutches for 3 months straight. I hobbled every single day to my classes, all the while carrying my backpack with all my books because I didn't have time to go to my locker. When the cast came off again, I still had the same amount of pain, so the doctor sent me for a stat MRI. As we drove to the MRI facility, I kept telling my dad how frustrated I was. But we had some hope because my aunt worked at this MRI facility and there was someone there that I could trust. I went through the MRI, and this time the MRI showed a lot more damage than the first one. 2 of my ligaments were completely torn. There was debris that was in the joint space. I had longitudinal tears in my peroneal tendons. Even with the results in his hands, this doctor still thought I had RSD, so he sent me to one of his neurologists to confirm. I saw the second neurologist and was told I do not have RSD. The orthopedic called my mom with the results. He said, even though RSD has been ruled out, I just have a feeling that she has RSD. My mom respectfully said, Doctor, your neurologist ruled it out, and quite frankly, your feeling doesn't mean anything. The doctor then suggested we go to a pain clinic. Thank God we went there. The pain doctors looked at my MRI report and told me, of course you hurt. You have torn tendons and ligaments. They asked if I would be willing to see one more doctor. I agreed, and they immediately called another orthopedic surgeon. I saw Dr. Miller shortly thereafter. And guess what? I was in surgery in a week to have my ankle reconstructed. It's bringing up a lot of emotions, and I keep losing my spot because I can't think straight. During surgery, my surgeon first used an arthroscope to look in the joint, and he found a lot of debris. He then made an incision on the outside of my ankle and found I had multiple longitudinal tears in my peroneal brevis tendon. My tendons were subluxating out of the groove. That's what I was feeling. That clunking in my cast, that popping. In hindsight, I now know what it was. It was my tendons. Ugh. In order to keep my tendons from popping out, my surgeon deepened the groove in my bone and then secured my tendons with drill holes and then used anchors to help stabilize them. 2 anchors were put as well in my anterior talofibular and calcaneofibular ligaments. It was a really, really, really painful surgery and explained why I was never able to get off of the crutches. It took 5 months from the time of injury to the time of surgery. It was so eye-opening to find out that just because I was a 16-year-old girl, doctors repeatedly thought I was being overdramatic, even with my parents assuring them that this was not my personality. When I found out I needed surgery, I would have jumped for joy if I could have. I was so relieved to find out that my ankle could be fixed. Surgery was at the end of February 2006. I knew I wouldn't be able to play soccer in the spring, but I started mentally planning out how I was going to get back in shape. To my surprise, however, when I woke up from my ankle surgery, my ankle was numb. They had given me a nerve block to help combat the pain. When I woke up after surgery in PACU, all I kept saying to my nurse was, "I am having terrible knee pain." Surprise, the extent of that injury, of the injuries from when I fell trying to catch that football, had yet to be discovered. My knee, my knee, my knee. The nurse thinks I'm confused. She tells me that I had ankle surgery, not knee surgery. I tell her I know that, but right now I have no feeling in my ankle, and my knee is killing me. She pushes pain medication into my IV and tries to make me comfortable. As the nerve block wore off my ankle that day, so did the pain in my knee. The pain in my ankle was excruciating, therefore masking the pain I did have in my knee. It was not an easy night in the hospital at all. As if hurting from the surgery wasn't enough, I had a bad reaction from general anesthesia, making it very hard to breathe. I developed stridor. Every breath was short and raspy and more difficult than the next. My oxygen intake was low. I had on an oxygen mask and it wasn't working. The nurses had to give me a shot of epinephrine, which caused my heart rate to go insanely high. It felt like my heart was going to beat right out of my chest. Luckily, the one shot of epinephrine opened up my airway and I was able to breathe normal again. To this day, I never want another shot of epinephrine. Before I left the hospital the next day, I told the nursing staff the top of my foot was burning. I was told the dressing was probably wrapped too tight around my ankle. So before I left, the dressing was loosened. For the next week, I watched a lot of movies, worked on homework, and tried to recover. But the top of my foot was still burning. As my mom usually does, she takes things into her own hands when she thinks something more is going on. So she called my family doctor. This was after she called my orthopedic who fixed my ankle. He said nothing was wrong. It was just normal pain. It's gonna hurt. She had surgery. But my family doctor, he prescribed me antibiotics just in case I did have an infection. Guess what? It's a good thing that he did. My family practitioner saved my surgeon, like he saved his butt. Because the next day when I saw my surgeon, he took off the dressing to assess the ankle. And to his surprise, the top of my foot was infected. I developed cellulitis. Cellulitis is a type of bacterial infection on the skin. Lucky for me, we caught it early, and I was only on antibiotics for 7 to 10 days. But to this day, I have a scar on the top of my foot. It never faded. For the next 6 weeks, I was on crutches and in a cast. Come the beginning of April, I was transferred into a walking boot, and I was allowed to slowly get off of the crutches. I was so sick of being on crutches and lugging my backpack around, so I was thrilled to hear this news. I was happy that I was finally headed in the right directions. Things were finally looking up for me. I was progressing in physical therapy beautifully, and everyone is confident that fall is a realistic goal for me to set to return to soccer. Life sure did look a lot different for me than your average 16-year-old. I basically lived at physical therapy in doctor's offices. I couldn't drive because the damage was on my right leg. I relied on my parents tremendously. I learned that even though I was injured and didn't feel well, life still goes on. There are still homework assignments to be done, projects, tests, and quizzes that I am responsible for. Being injured and needing surgery is not an excuse to disengage from life. At the end of the day, I am the one who has to be responsible and get all of my assignments turned in and on time. Even for missing a lot of class, my grades got better because I made it my job since I wasn't able to hold a regular job. It was extremely hard, but I needed to feel like I had some sense of control in my life. I also needed that sense of control because things didn't look good for long. As physical therapy progressed and we tried putting the crutches to the side to work on weight-bearing exercises such as walking, squats, balancing on one leg, etc., all of a sudden the knee pain I had woken up from surgery with returned. I thought to myself, this cannot be happening. I have had enough of being injured. All I want is to get back to normal. Since my right knee kept swelling by the end of every single physical therapy appointment, my physical therapist advised I go back to my orthopedic to have my knee evaluated. So off to the doctor once again. Now that I know that I have Ehlers-Danlos Syndrome, so much makes sense. It makes sense how one really bad landing caused like a domino of injuries in my leg. It makes sense that the bones did not break and it was a really bad ankle sprain. My tissue is stretchy and the ligaments were stretched to their capacity, and my ankle rolled in basically as far as it could roll. Instead of like a person with like normal healthy tissue, they would have broken their bones. And it would have been better had I broken my bones versus spraining my ankle. But I don't know if I'm posting this or not. I will decide. The facial that I'm making right now. Now you know what it's kind of like for me when I go to appointments to see my surgeon. When I see surgeons and they tell me, Meg, you need surgery, or whatever issue is wrong, I try to hold it together and not cry in front of them. I cry when I walk out. And as soon as I hit off on this camera, on this video, the tears will end up coming.